Well, hello and welcome to all of our viewers from around the world. I'm Fiona Langsharp, IBCLC Director of Communications and one of the MCs here at Gold Learning. Thank you so much for joining us all here today. I'm so excited. I've had quite the afternoon here having some fun with our guest who I'll be introducing you to in just a moment. But I want to get you updated first on, of course, what's happening. We are talking about our tongue tie symposium. It has come around, folks, so quickly again this year. I'm excited. It's coming up in just a couple of weeks here. It starts on September 12th for most folks, right? So it's a 2-day symposium. If you haven't joined us before, lots of options involved. So you can come for 1 day or 2 days. Of course, we want you to come for both because it's going to be jam-packed. And when I say that, I mean it. There's going to be 10 presentations in total to watch, which is just phenomenal. So clear your schedules if you can. Sit down with us, get ready to do a deep dive. It's going to be a lot of fun, and because you're going to be able to meet with colleagues from around the world, connect, ask questions of our speakers. Woo! So get ready. Now, if you can't join us for both the days, of course, you'll be able to listen to the recordings, which is absolutely fantastic. 2 full days of learning for this event when you register, and 8 weeks to listen to the recordings. You can find all the details right now at goldlearning.com. Really easy. So you can head over there and register and find out what's happening. But without any further ado, let's introduce our guest speaker here today. So Philip, it's so good to have you here. Officially welcome to Dr. Philip Hand, who is going to be here live at our Gold Tongue Tie Symposium. Welcome to Gold. It's great to have you.
It's an absolute honor to be here.
Well, I'm excited to hear your topic. We'll get into that in just a moment. But of course, we want you to introduce yourself and just tell us a little bit about where you are in the world and perhaps what your practice, like what do you do in a day-to-day? We want to learn more. So take it away.
So I am a general practicing dentist in Melbourne in Australia. Graduated in New Zealand many years ago. Being a half-caste Kiwi and Australian. General dentistry that has ended up in the last 10 years becoming very much a laser dental practice, practicing in all the fields of dentistry, and 1 day a week specifically set aside to see infants for tongue, lip, buccal ties, etc., but helping mums with feeding.
Excellent. Well, that's wonderful. And a whole day dedicated to those mums and babies, which is phenomenal. Well, I mean, this is so interesting. I mean, you've been around, admittedly, for some time, Philip, we can say that, right? So you've seen some changes in your time. And so I want to know a little bit about how this has all transpired. So did you already know about breastfeeding issues like early on? When was it first introduced to you? I have so many questions. Yeah. When was it first introduced to you? How did you get involved? And how does that look like for you today?
I have had a couple of lactation consultants as patients for decades. And in the space of a month, both of these ladies asked me, do you do frenectomies? And as a general dentist interested in surgery, I naturally said, well, yes, it's dentistry. They said, infants? And strangely enough, I thought to myself, well, that's different. How hard could that be? Well, yes. What a naive question that was to myself. We then ventured into looking into what was involved and realized just how big a deep dive that would be. And the rest is history.
Wow.
We've been very involved in it ever since, and the wonderful community involved with it, because you are talking with and being with knowledgeable pediatricians, but mainly I find the body workers, the pediatric osteopaths, pediatric chiropractors, and of course lactation consultants, and here in Australia we call them maternal child health nurses, who are what do we call them in your part of the world, the healthy beginning nurses. And as a consequence, just becoming more and more involved and meeting wonderful, wonderful people from around the world, because it's a real community, which is
Mm.
exactly what Gold Learning is so involved with.
Yeah, absolutely. And, you know, like you, we have seen this grow, you know, it has a momentum of its own, particularly, I mean, obviously lactation is our big conference that we have here every year, but tongue tie, you know, is a huge standalone, you know, and it stands out and it continues to grow, Philip, you know, that's why we need to keep bringing in some great presenters like yourself, you know, to teach us you know, on different topics and different aspects, which, you know, we all get very hungry and excited for each year, because I can tell you as a practitioner, you know, things continue to change and grow, and we're learning all the time, you know, alongside you. Tell me a little bit about your sort of your training, because I know you have met with other colleagues from around the world, and I think they have probably inspired you quite a bit as well. So you've had an opportunity to learn from them as well, and grow as a community in dentistry, correct?
Absolutely. And by listening and learning from pillars of the community in tongue tie, people such as Larry Kotlow, Suresh Zagi, and of course Bobby Gahary. We also in Australia, you've had presentations from people like Margin Jones,
Yeah.
who is also very, very passionate in the field. I've thoroughly enjoyed the time I've spent with Margin, learning from her, etc. And so and then in Europe with my professor at the Sacred Heart University in Rome,
Mm.
Giovanni Allevi. So there are just many, many folk I've been involved with along the journey. And of course, within all professions, we should all be learning from each other.
Yeah, no, absolutely. I think that's one of the things that we've seen the most grow most recently in the tongue tie field is the collaborative work that we've been able to do, bringing all the different professions together. And that's, you know, this is where it really stands out, because I think, you know, when you think about a mom and baby, they really touch many different lives. You know, they're in contact with many different healthcare providers, and you know, making sure that they're both healthy is really important. So I certainly can say that I've appreciated learning from so many different didactics over my time. So that's wonderful. Well, let's get into your topic a little bit. So your presentation is titled Research Findings on the Short Lingual Frenulum and Reflux. So I'm like, ooh, this sounds good. It sounds juicy, you know, because those things, of course, come into play quite frequently in our practice and what we hear and see from our patients. So, you know, give me a couple of insights into, you know, some of these things that you're going to be teaching us on our tongue tie symposium.
Well, trying to get more information out there and in science
Mm-hmm.
for our mothers and infants, that the naysayers are forever telling us that we don't have random controlled trials, etc. It's very difficult to do such things. How do you do a sham frenectomy?
Mm-hmm.
So what the more practical thing is, where the rubber hits the road, is where we do actual surgery. What results do we get?
Mm-hmm.
Just trying to prove that that is important, and that in the real world it does work. So what do we have to gauge? We have to gauge pain or lack or no pain for mothers. We have to work out, is the baby still suffering from reflux issues?
Mm.
And with the breastfeeding self-assessment, being able to use a validated tool to make sure that breastfeeding is working better for mum.
Right.
So those tools, and then checking on those 1 week and 1 month post-surgery,
Mm.
were very satisfying to find that we had such wonderful results. And it's nice to be able to verify that what we do is
Mm-hmm.
working.
That's awesome. Yeah, that's
Yeah.
really good. And I think, learning from you and understanding, even how you went about putting this in place, or, how effective it was, is going to be supportive and helpful for those coming in, or even in comparison, the results that they have been getting as well, and how we can continue to communicate this to the broader community, because that's really the key thing, as you mentioned, for folks who really haven't been able to understand or see the things that we see, in its totality. I think is going to be of great value. So, but we need people to come and join us and learn in this community so that we can continue to grow. And I always say it's one mother parent at a time, that we're seeing and changing. And and understandably, there's still, I think, still some fear in the community about what is happening, and how to manage it well, and so forth and so on. And I want every family to have every opportunity of success, like you do.
Oh,
um
absolutely.
yeah, it's
And
what we live for.
making sure that they are going on the right journey, that
Mm,
surgery isn't the right journey for all sorts of reasons. For you've got to pick the case that's it's going to be right for. Very
right,
commonly it's muscular tension, it's infants who've had a difficult birth,
right,
it's rather than surgery, so that it's not all of us being frenectomy mad. We're
right.
just wanting to get the right result using the right tools, and that very often is not surgery. So I'm
Yeah,
more than happy to be pointing people in the right directions, as opposed to just going, "This is you're here."
that's right. We're going to do it. Yeah,
Yeah,
without any regard. Yeah, and like I said, this is where our wonderful specialized body workers come into play. I know you mentioned that you have osteopaths, which is wonderful, and
mm,
we are seeing physical therapists come into play now, cranial sacral therapists, chiropractors. I mean,
yeah,
there's a whole world out there. The myofascial, practitioners as well. So there's a whole world of folks out there who can gain knowledge, have the knowledge,
yes.
and we're gonna bring them all together. Yeah, it's gonna be wonderful. Thank you so much, Dr. Philip Hand. It's been great chatting with you.
Thank you very much.
I'm looking forward to your presentation. Of course, for all of you listening in right now, don't forget you can head over to our website right now at goldlearning.com to find all the details on this symposium, our Tongue Tie Symposium 2022, which is going to be over 2 days. And for those of you, it will be the 12th and 13th. Some of you will be slightly different timelines, but when you go to our website and you log in, it will give you the timeline correct for your area. So I reassure you, you can check in when you go onto our website and check out all of our amazing speakers who are going to be joining us on the 2-day event as well. Well, thank you again to Dr. Philip Hand for joining us here today. And of course, to all of you, our viewers. Have a wonderful rest of your day, everyone. Bye-bye for now.